Hello, I'm Dr. Mark Hudson-Peacock. I am the Chairman and Medical Director of eXroid. And I'm joined today by Graham Basson, who is our founder. He was the one that introduced me to the idea of electrotherapy as a treatment for hemorrhoids back in 2012. I'll let Graham tell you his story, and then we can pick up and sort of fill in some of the gaps along the way. Graham, tell me how it all started.
Yeah, so as it's no secret, I was a hemorrhoid sufferer for quite a few years, and I had hemorrhoids for around about 5 years before I decided to do something about it, because it restricted me from so many activities that I wanted to do. And like, you know, I'm just a normal person, you know, like the millions of sufferers out there that are going through what I went through will understand that it's no laughing joke. And there's so many jokes about piles and hemorrhoids, but it really is no laughing matter, as you know, Mark. So
one of the things you told me about when you went to the gym, the sort of problems you had there.
Yeah, I had many problems, and as you know, I like to ride motorcycles, and it stopped me doing that because, you know, sitting down on a sports motorbike racing around Brands Hatch or something like that, you can't do that with the pain of the hemorrhoids that I used to suffer with. So what happened was in 2001, I decided to actually go to my GP, and I thought I'd just do something about this. So I went there, and the upshot of it is I was offered a banding procedure, which you're familiar with, and where they slip a rubber band over the hemorrhoid and they wait for it to drop off. Wow. And I thought, well, I don't really want to be awake while they're doing this. It sounded awful. But many people do actually have the banding procedure done while they're awake. But anyway, I went in there and I was put to sleep, and I thought, I woke up, and for a few hours after I was fine, and I went home. I was discharged from hospital. And increasingly, as the hours went ticking past, my hemorrhoids were throbbing, and it was so painful that at 6 o'clock in the morning I could bear no more, and I put myself into A&E and said, "Please sort me out. I'm in so much pain." Following that, they give me an enema, amongst other things that they had to do, because I was constipated. Then all the bands dropped off, and then I was admitted onto a ward for a few days with some kind of infection, I believe. When I came out, after realising and talking to the colorectal team there that hemorrhoids cannot actually turn cancerous, I vowed that I would always live with hemorrhoids.
You didn't fancy an operation to cut them out then?
Well, they offered me the operation, and when they told me that it's one of the worst procedures you can have done, and literally they cut the hemorrhoid out and stitch you up. I mean, how does that work? I mean, you try to go to the lavatory after that, but you know, but how does that work as a, you know, it's certainly, you know, when you want to go to the toilet, that's not very helpful. Yeah. So from that moment on, Mark, I decided that I would live with the hemorrhoids, and which I did for many years. And I was off on holiday in Koh Samui, which is in Thailand, and I flew back into Bangkok 2 nights before I was due to fly back to the UK. And it was whilst I was sitting around the pool, I'd got up, had my breakfast, and I'd gone to the gym, and I was sitting around the pool for the day before I was due to go home the next day to the UK, when remember sitting there thinking, God damn, am I going to do a 12-hour flight with that, because my piles were throbbing away. And by stroke of luck, a chap sat next to me and started talking to me and asking me what I was doing in Thailand, and I asked him, and he told me about this new procedure, electrotherapy, and that he was trying to actually bring it into Thailand. So when he showed me this video, and he said it's virtually pain-free, and I went, pain-free? It sounds too good to be true. But what happened then, Mark, he showed me a video, and I could see in this video, that it was a live video of the hemorrhoid literally shrinking in front of my eyes as they placed the 2-prong probe on the base. Yeah. And I went, is this in the UK? And he said, no, we're just not there yet. I said, I'm the man to take that to the UK. He said, I said, I know some medical people that I can approach and get this into the UK. Fortunately for me, he had an NDA faxed over to me, non-disclosure agreement, which I signed. And then I came back to the UK, and I spent 2 years, Mark, sorry, before I realised you were the right person to speak to. But I spent a couple of years trying to speak to some gastroenterologists, certain surgeons, and I was barking up the wrong trees because none of them were interested. They didn't want to they were either too busy or they just didn't, believe in what we had. And it was one morning, I remember waking up and I thought, Mark, Dr. Hudson Peacock, maybe he can help me. Maybe he can, direct me in the right way so I can find the right people to do this with. And I made it my mission to actually get this treatment over here so I could be treated, and if it worked, my mission to let many millions of sufferers have this treatment if it's true. And as you know, Mark,
I remember you coming to me that day and telling me about this piece of equipment that you got for a particular condition. I didn't know it was for hemorrhoids then, and because I'm a dermatologist, a dermatologic surgeon, and you said, I've got this great bit of kit. I think you might like to get involved. I said, well, what's it for? And you said hemorrhoids, and I said, hemorrhoids? I said, but I'm a dermatologist. I don't do that. But when you told me a bit about it, and I thought, well, because most of the treatment was done in America then, if not nearly all of it. And when you said that most of the people that were in treatment there were GPs, I thought, well, if a GP can do it, so can I. I had been a gastroenterology registrar for a number of months before and was quite familiar with that examination, doing proctoscopies and sigmoidoscopies and taking biopsies during that job. So I thought, well, if a GP can do it who hasn't been trained in those things, there's no reason in theory why I couldn't. But I need to find out more. And that's when I contacted the American company and asked them to tell me a bit more about it. And then I did. And then I did my own independent research. So you remember that?
I do. And one of my main, if you remember, keys to this is, look, I need to be treated. Yeah. So you need to.
Selfish view about this.
No. Well, I vowed I would never let anyone touch me down that again, and I found it. So the story is that Dr. Mark Hudson Peacock, I'm very proud of, went off and got the training done, came back over here. We both visited the American company together. Came back over here and. I really had to put my backside on the line and get treated. So hopped on the couch and we found it very strange because we were friends that you should be doing this kind of treatment for me, because I'd had other treatments done by yourself, as you know, but it was the other end, not, anyway. I remember though, after getting up off of the couch, that I felt immediately some kind of relief. And then... Because
you said, I feel better already. I said, oh, come on, stop.
No, I did. Yeah, I did actually.
But you did feel better already.
But I do notice that after about 3 weeks, I thought there wasn't much improvement. And then I phoned you up and you said, well, it can take up to 4 weeks, Graham, so, or you might even need a follow-up procedure. I remember the words, and I didn't really fancy another procedure, but it wasn't that bad. I'd have to go through it, We had a laugh anyway the last time, so we thought. But after 3 days, I remember that phone call. I phoned you back and said, do you know what? I've noticed a big improvement today. So I did actually need the follow-up procedure. And when I came over, it was about 7 weeks after the first procedure. You treated me again. We had a laugh as well. And then,
not during the treatment, though.
it was afterwards. But I must admit, though, after about 3 days of that second treatment, Mark, I have to say that's when we both knew that we had something special.
Yeah, because you rang me up again and said, do you know what, I feel better.
It completely disappeared. All the symptoms are gone. In fact, going to the lavatory was like going to heaven. It really was. It was that good. So we both knew then that from that moment on, we had to do something about this, as you know, and get this into, first of all, across the UK. And we grew the business, you and I and Patrick, our partner who's now retired, we grew the business to 14 clinics across the UK, and with great results. Yeah, brilliant.
Yeah, and we'd had a number of meetings we'd gone to spread the word amongst doctors, because we need to get to doctors and patients.
Sure.
And with limited money at the beginning, we had to be careful, and grew it steadily.
Yes.
As demand grew, we found another doctor who was interested to be trained, and then set up another clinic. And then there was that dreadful day in that September 2016 when we discovered that the American providers of the
that was not such a good, because you know, not only did we wasn't able to treat patients because of what happened with the USA, and they lost the FDA approval. We had to turn many hundreds of patients away that were already booked in and in the middle of their treatments, because some patients do need, as you know, follow up, like myself, treatments to get symptom free.
But we believed in it so much. We thought, we can't let this go.
No.
And so we found out that we could design and make our own electrotherapy equipment. And that's the journey, the next chapter in our journey together.
That was challenging, wasn't it? That was 2.5 years.
Hard work.
But I think one thing, through our journey of being together, Mark, one thing I have to say, and is that I was just a normal person, like so many other sufferers out there that had hemorrhoids, and I thank you that you were brave enough to even go into partnership with me.
Yes.
Because I wouldn't go in partnership with myself, that's for sure. But you were brave enough to take the challenge on, and I thank you. And we now have, it's a mission for us to deliver this treatment, not just here in the UK, not just in Europe, but across the globe, because we believe we're the only manufacturers now in the world that actually manufacture electrotherapy treatment.
That's true.
And I think we both believe in it. We both have the passion. I think we were the right two people to go into partnership together, to be able to achieve what we've done. And I believe we're just scratching a tiny bit of the surface. And there's so much more to give to the patients and the sufferers across. This is, I believe this is the best treatment in the world.
I absolutely agree. And that's based not just on my experience of treating over 1,000 undertaking over 1,000 treatments and seeing the results that most patients have. People walk in, they have it done, they walk out again. Sometimes they have a bit of discomfort afterwards. Sometimes it's uncomfortable during the procedure, but we can manage that, because that's the beauty of electrotherapy, is that we can gradually increase the current that we're using to deliver the treatment. And if it's a bit uncomfortable, we bring it back down again. So we try to get patients to where they need to be, which is get their piles treated, and they get up, get dressed and go out. And I always remember the nurse that worked with me and the first lady I treated. It was one of those moments where you think, this is something very special. The patient had her treatment. She'd had her piles for 43 years since she'd had her daughter. At the age of 30, she was 73. She'd not told a soul. I was the first person she'd ever told that she had hemorrhoids. And so, as a doctor, it's a privilege that I've never lost as a doctor in any of the things I've done, is that patients trust.
Yes.
And having gained her trust, we treated her. She got off the couch at the end and she said she'd had grade 3 hemorrhoids. And she said, I feel better already. She said, I really feel better already. She smiled and got dressed. And the nurse came to me after. She said, do you know what? I've worked with surgeons for many years, because she was a theatre sister as well, and said, I have never seen a patient, whether they've been banded, injected, or had a general anaesthetic procedure, when they've come through, say, do you know what, I feel better already? I've never seen that before.
Well,
it's fantastic.
I remember when Mr. Mackey, Paul Mackey, who's one of our senior consultant colorectal surgeons down in Taunton, Somerset, he came to your clinic in Canterbury and watched the procedure. To see if he was going to actually go on and perform the procedure. So that was the first step, coming to you, watch you do a few patients. And I remember you were busy, you were chock-a-block that day with patients for electrotherapy. So I met Paul for lunch after he'd seen just 3 patients being treated. And I remember meeting Paul, and he's saying to me, and he's a colorectal surgeon, he said, in the 20 years that I've been doing this, Graham, he said, I have never, ever seen somebody get up off the couch and say, I feel better already from a hemorrhoid procedure.
Yes.
It does work. It is the gentlest of treatments. It really is. And I speak from personal experience because I've had the treatment. If I was to be unfortunate again to get hemorrhoids, I would not think twice about getting up on the couch again. Yes. And getting treated, because it's you know, it's very gentle, and you can get up and go along with go about your everyday life immediately upon leaving the clinic.
And
so
some of the patients I've had over the time, I mean, you've known some of the stories I've told you.
I speak to many patients, yeah.
And I've had patients who've had hemorrhoidectomies. I've had 2 patients who've had 2 hemorrhoidectomies and still had symptoms.
Yeah.
And having gone through the hell that they've gone through in the post-treatment phase, there was no way they could have a 3rd hemorrhoidectomy. Their surgeon said, I'm sorry, the risks are too high.
Too high, yeah.
So I'm sorry, you're going to have to live with them. So they were managing, and when they came across electrotherapy and came to see me, they could not believe the simplicity of the whole procedure, the comfort of the whole procedure compared to what they had before. And both patients, one had 1 treatment and one had 2 treatments to be completely symptom-free, and both of them, one of them actually came all the way down from the Midlands just to shake my hand and say, thank you for changing my life. And that blew me away. And I think that's the sort of stories that we get from patients.
Well, I remember one of your patients was an elderly lady of 83, and I picked the phone up and she spoke to me and she told me, I've got grade 4 hemorrhoids. I've been to the GP. They've offered me surgery to cut them out. And she said, and I've seen an advert in the paper today, because as you know, we advertise in the Mail, Daily Mail. And she said, and can you tell me about the procedure? When I told her about the procedure, she said she'd give it a go. Yeah. Now, normally, as you know, with a grade 4 hemorrhoid, you're going to need more than 1 procedure normally, yes. Although we have had in the past some patients that... This particular patient had very, very large prolapsed hemorrhoids and they bled. So she booked into your clinic, and I kept an eye on the time when she was going in, and I knew to be mindful to call her. So I called her about 4 weeks after the procedure. Yeah. 1, to see how she was, as we do, yes. And I talked to many patients, as you know, Mark. And 2, to see if she did need me to book her a follow-up procedure, because I remember at the time we were starting to get very, very busy, and your time is very valuable and you have a very limited space of clinic time. So I didn't want her to miss out on the slot. And I phoned her, and I remember her saying to me, I said to her, how are you? And do I need to book you in for another procedure? And she said, Graham, I feel like a new woman. She said, I don't have any prolapsing and I've stopped bleeding. She said, I've been walking the dogs. You've given me my life back. Yeah. And she wrote a testimonial for that. So
and that's what gets us every time. It's those testimonies from patients who've been through whatever problems they've had, whether it's been itching or discharge or prolapsing or bleeding. Some people having a hellish life, and some people it's a minor inconvenience occasionally. But them then telling us, gee, you've changed my life, I don't have to worry about them anymore. They're another thing.
And the other side, Mark, though, the thing that also there are patients that have had hemorrhoids for quite some years, and they don't get the one-time success story like the 83-year-old lady, and we're very truthful about that at eXroid. So we're very mindful of the fact that one treatment might not be the one that gets you home and dry. Yeah. However, what I will say is that patients that come in, get their treatment, 4 weeks later, as you know, we always do a follow-up call, 1, to see how they are, and 2, do they need a follow-up? Because we don't know. We let our patients tell us how they're feeling. Yeah. What I do know is that patients that do need follow-up procedures, they also get quite a bit of relief from that first procedure. Yes. And then they can't wait to get their second procedure. Yeah. Because they know, you know, this is working for me, and I don't have to have what was offered to me, which was a hemorrhoidectomy. Yeah. I mean, this is something that's really encouraging from all aspects. There are some patients that want it gone in one treatment. The reality is that we can't guarantee it, and it,
About
you know,
half of our patients, we know from the data.
50% of our patients only need one procedure, and 80% only two. So many of our patients are symptom-free after just one procedure. But
I've had one patient who's come back, I think, from when I first started in 2013, over that time, probably 11 or 12 times. Which is, you know, outrageous.
Oh, I
He
know the chap.
I'll have this 100 times.
Yes.
I will never have surgery.
Yes. So I know this chap very much because I've booked him in every time.
Because he came from a distance away and used to come down to the hotel.
First of all, the Canterbury clinic, as you know, your clinic at the time was the only one that was available to people. Used to fly in from all over the different countries, but down from Scotland. And this chap used to come from Derbyshire, I believe, and he'd come down for his wife. I used to book him into the Castle Hotel, isn't it, at the end of Castle Street? Yes, and he used to enjoy coming down every 6 to 8 weeks, have a procedure, because every time they were getting smaller and smaller. But he'd had his hemorrhoids for 45 years. Yes. And I remember, as you know, when we had the gap, the 2.5 years, he came back for the final procedure, and I called him to see how. I said, Graham, they've gone. So the interesting thing was the gap didn't actually make any difference. I think where you treated him,
they hadn't deteriorated.
They hadn't deteriorated,
which was great to know.
It was,
The anticipation is that piles will tend to get worse, but not in all patients. And I think he'd been sensible with his lifestyle choices, his diet, and so on, so it kept them stable. So that was really good. But I think at the end of the day, patients' journeys are variable. Most of them are very quick. Some are a bit slower than others, but ultimately they get to where they want to get to.
I think I'd like to say a message to any sufferer that's listening to this recording of us talking, is that we generally know that you could come to us and get treated and start the journey of getting your hemorrhoids sorted, either in the early stages or whatever stage. If they've been hanging around for 20, 30 years, we can still treat. And I think that it's very satisfying for you and I that we've managed to be able to offer this to hundreds and hundreds of patients, not just past, but in the future there's going to be more and more people.
Absolutely. And I've just mentioned the other group that I get a lot of professional satisfaction out of treating are those where patients with hemorrhoids that are symptomatic have gone to their surgeons, they've been assessed, and because of other health problems, whether they've had a stroke, whether they've got cancer. I've had patients who have been dying of cancer but had terrible hemorrhoids affecting the last days of their life, causing enormous problems. And no anaesthetist would touch them, no surgeon would touch them because of the risk. We could still treat them. And I've treated patients with advanced prostate cancer, with other forms of cancer, where their hemorrhoids are getting in the way of them trying to enjoy what time they had left. And being able to treat them was just such a joy to get that problem out of the way so that they could get on with trying to do what they wanted to do as their life was coming to an end. It's a treatment that's we can treat all patients. There are very few we can't. We don't treat ladies who are pregnant. We don't treat people who have got nasty infection down there. But basically anyone with symptomatic disease we can consider treating. If they've got pacemakers, we can still treat them, but we need to make sure that their pacemakers are of a type that will either allow our treatment to go on, or we can turn them off if it's appropriate, and then turn them on again afterwards. So even those sort of challenging groups, and those on blood thinners, where if they're going to have surgery, they need to stop and change. And with this, we can treat people on blood thinners, and that again makes life a lot less complex.
The other thing is as well, I've had many patients that I speak to on the telephone, and they've had all the other procedures that are possible out there. Eventually they found us. None of the other procedures have actually worked for them. They've come to eXroid, we've treated them, and we get the success story. I know. So I think there's more success. Or we got by the way, a net promoter score now of 80 odd, which is world class. I mean, come on, for a medical company, that's really quite
I think
something.
that's something we're extremely proud of.
We are.
So the Net
we
Promoter Score is a standard where it can be applied to all different companies,
Yeah.
not just medical, and it relies on patient feedback. And anything that's above 70 is world class, and we're hitting 80.
Yeah, we're proud of that,
And
aren't
we're
we?
very proud of that,
Yeah.
because that means we're doing something right. Our patients like what we do. We're not perfect for
Yeah.
everybody, and no
I
company
think,
would be brave
I
enough
think
to
we
say
have
that,
to
and
give
we're the
credit to
same.
the team that we've
Oh.
collected over the years
Fantastic team.
that are around us. I mean, you know, our MD, Michael
Yeah.
Wilshaw, he's brought some amazing talent through the doors, and you know, the wealth of knowledge that he has, we have to give him
Absolutely.
credit for. And going forward, I believe that you know, we're going to really.
We're poised to really make a massive impact on hemorrhoids, and we believe, and we
Sure.
know that through your personal experience, my personal experience in treating patients, and all the data and the testimonies we've had back. This treatment should be the treatment of choice for
Yes.
every patient with hemorrhoids,
Yes.
with odd exceptions. And if that for them doesn't work, then the other treatments are available, which are riskier. And there's plenty of evidence in the literature to corroborate that fact.
Yeah.
So we know we've got the best treatment, the safest treatment,
Yeah.
the gentlest treatment.
So how many patients have you treated now with electrotherapy?
I've done over 1,000 treatments.
Have you?
Yeah, I
Yeah,
know.
wow.
It's I know my way around a bumhole, that's for sure.
Yeah, sure. Yeah.
But at the
Yeah,
end of the day, we've
yeah,
all got
you
them.
do.
We've all got them, and they all do the same thing.
Yeah.
And it's an area that everyone's embarrassed about, for whatever
Yeah.
reason. Is that the
Yeah,
British thing? But
if
do.
we could, that's one of the
But
other
one of the things we do
missions.
is we look after them.
Yeah,
We
we
try to
do.
keep things discreet. We keep it. It's always professional.
Yep.
But we do like a bit of banter, and for
Yeah.
some patients, that is exactly what they need, because patients are awake when we're treating them.
Yeah,
And our
definitely.
chaperones are brilliant. I mean,
Definitely,
they
yeah.
really do make it a better journey for the patient.
Yeah.
So probably we ought to sort of wrap up, really, because we could go on all night.
Yeah,
And,
we could.
we
Yeah,
we
I mean,
probably
we've
will,
been talking
again.
about, but yeah, there's a lot of them out there. That's for sure.
Yeah. Well, we know from the data that there are, in this country alone, probably up to 8 million people suffering. And if we can start to treat a proportion of those who maybe will get the confidence now to talk to their GPs, or even if they don't, they can come to us directly. We are very discreet. We will generally communicate with the GPs, give them information about what has happened, and if further investigations are required. And if not, and if patients don't want us to communicate with the GPs, we're happy to do that. But
Yes.
at the end of the day, the patient is in control, and we're here to look after you. So, both from Graham and myself,
Yeah.
don't be shy. Pick up the phone. We
I
are
would just
here
like,
to look after
yeah, I
you.
would just like to say one thing. If you're a sufferer that's suffering from hemorrhoids like I was, then yeah, you need to give us a call, and I will make it my mission to try and speak to you personally and talk to you and answer any questions that you may have, and I'm sure we can advise you the right way forward. So thank you very much.
Thank you. Well done, mate.
Well done.
It's been a good job.